Good afternoon, Dr. Shell. Hope you're having a great time in Houston. I'm going to present my patient to you right now. He was a 63-year-old Hispanic male who came in for to follow up on his coronary artery bypass surgery he had 4 weeks ago. He was just had some chest soreness with movement stretching at the site of the surgical incision, and his past history was significant for coronary artery disease, severe left ventricular dysfunction, congestive heart failure, previous MI, type 2 diabetes, hyperlipidemia, hypertension, all that good stuff. And he also had a 40-pack-year smoke history. So his only complaint was mild difficulty breathing on exertion when he was like walking, and swelling in his legs, which he was taking Lasix for. And on physical exam, he had 2+ pitting edema. He has a history of congestive heart failure. So that day, the Entresto rep happened to be in the clinic. So I decided to look more into that drug and compare it to enalapril. So that's my study, is whether the inhibition of renin-angiotensin system by an ARB combined with Entresto with neprilysin inhibition, which is Entresto, would be more effective than ACE inhibition and enalapril in the treatment of chronic heart failure with reduced ejection fraction. So this was a really interesting study. It was actually the largest heart failure study ever done. And the reason I picked this is because, as we know, ACE inhibitors have always been the mainstay of treatment for heart failure, in addition to beta blockers. But this study showed that angiotensin II receptor and neprilysin with Entresto was more effective in reducing the risk of death from cardiovascular causes or hospitalizations for heart failure. There was only 21.8% in the Entresto group that had death from cardiovascular causes or hospitalization for heart failure, compared to 26.5% in the enalapril group. And there was a 20% relative risk reduction for time to cardiovascular death or first heart failure hospitalization with Entresto versus enalapril. And then a total of 558 deaths in the Entresto group versus 693 deaths in the enalapril group due to cardiovascular causes. So these findings were very significant, and I would definitely, when I practice, if my patients can afford Entresto, that's going to be my go-to therapy, along with beta blockers and statin therapy and aspirin and all that. So I hope you enjoyed the presentation. Bye.